Hey everyone, Dr. Dalton Bruner. I am doing something new here and kind of interesting for everyone to see. So last night I was playing volleyball and I sustained an injury myself to my back. Kind of ironic and maybe funny that the chiropractor hurt his own back. However, I am human. This stuff happens to me too. The good news is I know how to work on this and I can treat it. And so I'm going to create a case series or a series of videos to demonstrate to you what my injury is, how I identify the injury, and what I'm going to do to fix it for myself. This is everything that I do for the people who come into my office with these kinds of injuries as well. So this is a really good opportunity to practice what I preach, okay? So what I did was I was diving for the volleyball and I hit the ground kind of hard and I hyperextended my back suddenly. But what happened was I believe I sprained my SI joint, which is at the base of your pelvis, where your pelvis connects to your spine. There's a big bony joint down there, and it's very left-sided for me. So it's not central, it's not in my spine, it's actually my pelvis. But it's right there, and it's low back pain, and it's exactly what so many people deal with. Like, I just know. So for me, I think this is a mild sprain, mild, maybe moderate at most. It's not that severe. I'm moving here, but I definitely feel this pain. So, a couple things that I've noticed with the pain that I have right now is, one, it definitely woke me up last night. I've been up since probably 5 a.m. because I couldn't get comfortable anymore. My low back was hurting. I did all the things I always do. I have a pillow under my knees to take pressure off my low back. I sleep in a neutral position. However, there's just this kind of gnawing pain going on. And that's pretty typical when you have an acute injury like I do. There's swelling in the joint right now. So I iced it, 20 minutes on, 20 minutes off. That helped decrease the swelling and the pain temporarily, which helped me kind of get back to sleep, which was nice. So then I woke up, and the things that I noticed was there's a sharp stabbing pain in my lower left back, and I'll show you in a minute where this pain is. I'm sitting right now, which is actually one of the things that also aggravates my condition. But I have a sharp stabbing, just pinpoint pain. I can point to it. And there's no radiating symptoms down my leg. There is some going up my back a little bit, but that's actually a muscle spasm. That's a muscle spasm because my body's trying to protect the joint that I have injured. And so that's pretty common. All right, so I'm sitting right now, and I do feel the pain sitting because the SI joint is a weight-bearing joint, and it is primarily engaged when you're sitting. So I've been trying not to sit too much today, but for the sake of this video, I'm doing it in the meantime. But the other thing I'm having pain with doing is actually going from a seated to a standing position, or that transition. And so there's a couple things that I teach people how to brace their body so that they don't use their spine too much when they're dealing with an injury like this. You really want to try to use your hips more. So what I'm going to do, I'm in a chair that has armrests. You can't see it, but I put my hands on the armrest and I'm bracing, okay? And so I'm going to push myself up with my arms versus using my back, all the way up into a standing position, and that is better. So I'm gonna move this chair out of the way, and I'm gonna show you guys, I'm gonna turn around and I'm gonna show you where I feel the pain right now. So I'm kind of bent forward, but I'm actually bending, you might not be able to see it very well, with my hips and not my back, and so I can do this okay. If I were to bend at my back though, that's when I would feel the pain. So I'm just gonna stand straight up with my hip joints, and I'm gonna turn around. And my pain is right here underneath my belt on the left side. It's not center in the spine. It's actually slightly to the left. Right there. It's pinpoint. It feels like someone's just sticking a dagger in it. So I'm having pain, bending forward from my back, which I'm not going to do, and twisting also. So anyways, I'm going to have a couple more videos of an exam that I'm going to do on myself to show you how I identified this problem. I'm also going to get a treatment today for myself. Gotta take care of myself too, right? But I'm gonna show you what that looks like and why it's beneficial. And then I'm also going to have one more video of recommendations that I give to people. And then I will have a follow-up video after that of how I'm doing and things I'm noticing as I go through my own healing response. All right, so thanks everyone. I hope you stay tuned. This will be interesting. Alright everyone, this is video number 2 of my case series in my own injury, okay? So I'm going to show you now an exam I'm going to perform on myself, which is also things that I do when I have people with this similar condition in my office, okay? So the first thing I'm going to show you is range of motion in my spine, okay? So I'm just going to do the lumbar spine because this is where my pain is. But if I were to bend forward like this, I start to feel the pain right about there, right in that lower left spot again, right here, okay? So that's about as far as I can go until I feel the pain. I could go further, but it would just hurt, you know? So I'm not gonna do that. Then I'm gonna go into extension, and this actually doesn't hurt at all, which is nice. I'm gonna go lateral flexion or side bending. I feel a little pull on the left side when I go to the right. Left side, it doesn't hurt at all. And then twisting. When I twist to the right there, I start to feel it catch pretty good, actually. When I twist to the left, I can go much further. I feel a little pinch, but it is not nearly as bad. So anything to the right side, it seems to almost aggravate my left side a little bit more. Just an interesting thought. I'm gonna sit down now. The next orthopedic test is actually gonna test for if this is a disc issue. But all I have to do is straighten one leg out at a time. And as I do that with my left side, I don't feel any pain. Right side, I also don't feel any pain. So that's good news. It's leading me away from thinking that this is like a disc issue. So now I'm gonna try to get myself down on the table without hurting myself. And I typically do this for the patient, but if I were to just lift my left leg up, this does not hurt until right about there, which is a pretty good amount of flexion in the hip joint. At this point, I'm starting to stress more of the SI joint versus my low back, so that kind of tells me again that that's probably an SI joint related problem. So then the right side, I have no problems. I can get all the way up, that doesn't hurt at all. If I were to bring my hips up, I have good hip range of motion. Right at the very end, I start to feel a little pull, but it's not that bad. Same thing on the right side, no real pain here. So that's good news. I'm gonna roll over to the stomach. And these tests are actually more designed for the SI joint at this point. So if I were to bend my left knee, this doesn't really hurt. If I go in, I start to feel it pull though, and it does kind of hurt right there. If I go out, that doesn't hurt at all. So that tells me there's maybe some muscular involvement or a little spasm going on over the SI joint. If I go to the right side, again, this does not hurt. If I go in, there's a little pull. It's not too bad, but a little bit. And then if I go out, that one's okay too. So far, all these tests are showing me, I think this is my SI joint, and I think I sprained the ligaments around it like we talked about in the first video. My last test I'm gonna do, since bending forward or flexing at my spine hurts, I'm gonna try and actually go into more of an extension. So I'm just gonna easily kind of push up like this, and this actually relieves a lot of the pain. This feels very good. And so I'm gonna hold this for just a moment. And I can feel that in my low back, it just feels like the muscles are actually relaxing. As I put myself into a little bit more extension, it kind of takes pressure off those ligaments. So yes, all right, so the last thing I'm gonna show in this video is how to get up off the table now that I am currently in a position where transitioning hurts to do. So what I'm gonna do is I'm gonna roll to a side, preferably the more comfortable side to roll to. And then on my side, I'm gonna take one hand, I'm gonna push myself up, and I'm gonna swing my feet to the floor at the same time, just like so. So I do that because it doesn't make me bend at the spine, and so that didn't hurt to get up at all. If I were to just kind of do a sit-up to get up, that probably would hurt a lot worse. So that was a short little mini exam to kind of identify to me that I think this is my SI joint that I sprained. I'm gonna have a couple more videos now on the treatment and the things I'm gonna do to help fix this problem. So again, Dr. Dalton Bruner with Injure Chiropractic. Thanks y'all, have a good one.